What are nurses? We are educators, listeners, leaders, patient advocators, and healers. We stand by and care for our vulnerable patients despite all circumstances. We are there to hold their hands in times of sadness and rejoice with them in times of celebration. We assess them not only scientifically, but also socially, mentally, and emotionally. As a nurse, I vow to care for my patients holistically, embodying each of these characteristics. In order to optimize my patient's health, I will practice patient-centered care by listening empathetically while being culturally sensitive. Also, I will educate my patients in order to help alleviate any anxiety or confusion they might have. For example, I would teach a new mother how to properly breastfeed her newborn baby before going home, which might help make her comfortable for caring for her child independently. Also, I will practice interprofessional teamwork as a nurse in order to develop an effective care plan for my patient. As I learned from simulation, if I were meeting to discuss a patient's discharge, I will make sure to advocate for my patient while respecting each of the professional viewpoints. I will then make sure that my patient understands the necessary steps to take after being discharged. Lastly, I will be confident in my skills as a nurse and knowledgeable of my scope of practice. For example, if I am given a task that falls out of my scope of practice, I will step away in order to prevent any errors from occurring while caring for my patient. Communication is crucial to ensuring optimal healing for my patients. As a nurse, I will not only be communicating with my patient, but also many other nurses, physicians, dietitians, and other healthcare professionals. Communication is a vital part of nursing, especially when caring for a scared, vulnerable patient. When dealing with high-stress situations, it is always important to remain calm and collected, only shaking from the knees down. As a nurse, I will be assertive in my communication. For example, it may be frightening to call the physician late at night when my patient is not responding properly to treatment. Rather than being passive, I will call the physician, remaining calm and professional as I respectfully explain the situation. Although they may get upset, I know that I did the right thing in the situation. I will continue to practice the tips I have been given in order to effectively communicate as a nurse. During nursing school, I will learn and develop many key skills through simulations, clinical settings, and coursework. Within the simulation setting, I will be able to practice starting IVs and other basic skills in a safe environment. By mastering these skills, I can then confidently carry them over into the clinical setting. Clinical experiences will help me become acclimated to the hospital environment, challenging me to develop communication skills with not only the patient I am given, but also the different nurses I will be working with. Clinical experiences will also help me learn how to properly use my resources within the hospital setting should I need them. Lastly, coursework will give me a vast amount of information that I will need when assessing my patients. Upon graduation, I will be relieved to say I survived. In addition, I will have a multitude of information from each of these experiences. However, my learning does not end once I graduate. In order to perform proper evidence-based practice, I must continue my education in staying up to date in the latest health research. As I begin to focus my research on a specific population, I will continue to learn new things and develop new skills. As nurses, we learn new things each and every day. In my future practice, I will use the knowledge, advice, and skills I have been given from my professors and courses during my college career. When I do become a nurse, I want to let my patients know that I will care for them as a person rather than just a patient. For example, if I am caring for a child undergoing surgery, I might ask him or her or their parents to tell me about any fears or concerns they might have regarding the surgery. We as nurses are called to help people in every way that we can. I knew I wanted to be involved in nursing because of the integrity it upholds, the selflessness it demands, and the rewarding feeling it entails.